Hi, my name is Yoshiaki Yamanaka. I'm an orthopedic surgeon at the University of Occupational and Environmental Health Japan. Today I'll be talking about our paper recently published in the JBJS titled Molecular and Clinical Elucidation of the Mechanism of Action of Steroids in Idiopathic Carpal Tunnel Syndrome. One of the main difficulties in understanding the pathogenesis of CTS is that it's a disease with no clear onset and often for a subclinical course, making it difficult to compare the affected population to a completely unaffected normal group. To work around this problem, we thought that understanding the detailed mechanism of action of an effective drug, such as steroids, would help in understanding the pathogenesis of the disease. Steroid injections are thought to be effective in CTS due to their anti-inflammatory, anti-fibrotic, anti-edematous effect. However, their relative contribution has not been studied beyond clinical evaluations. Our research goes beyond clinical evaluation, including tissue sampling, electrophysiological studies, and imaging. The results show that triamcinolone decreases synovial fibrosis by inhibiting synovial fibroblasts, but does not have an anti-inflammatory effect or cause change in synovial volume by reducing edema. I was surprising because I thought that triamcinolone had a synovial volume reduction effect associated with anti-edema or anti-fibrotic effect. Based on this result, we conducted that triamcinolone acts by altering the quality, not the quantity, of synovium by inhibiting fibrosis. To use an analogy, imagine that you are trapped in a closed room filled with cotton. The closed room is the carpal tunnel. The cotton is the synovium, and the person trapped is the nerve. If you are surrounded by the soft cotton, you won't feel clamped. But if the cotton changes to hard clay, though the volume remains the same, you will feel clamped. I think the same is happening within the synovium. The steroid inhibits the fibrosis of the synovium, changing it from clay to cotton, thereby relieving the pressure without changing the volume. In addition, the softened synovium reduces the stress of the median nerve during flexor tendon sliding, which may also alleviate symptoms. Thank you everyone. I hope you find the article informative. For any comments or questions, you can always contact me at the email address listed in the paper.